call the Public Health Subcommittee meeting to order. We'll stand for our invocation. Father, thank you for this time that you've provided to us and blessed us with. May we be accountable to each other, to the people we represent, and most importantly, we be accountable to you. Be with us through this time as we venture into looking at providing services for our people. In Jesus' name, amen.
Amen.
Okay. Shelley, roll call.
Yes, sir. Mike Dobbins. Here. Carly Bezzard.
Here.
Peyton Duncan. Mary Baker Shaw.
Ani.
E.O. Smith. Denise Taylor. Here. Victoria Vasquez.
Ani.
For those that were involved in the 2019 election, I need you to either answer, well, tell me you're here, and then yes or no if you want to become a member of the committee. So, Keith Austin.
Here, yes.
Julia Coates. Sean Crittenden.
Here, yes.
Joe Deere.
Here, yes.
Rex Jordan.
Here.
Darrell Legg.
Here, yes.
Wes Dunbar.
Here and yes.
And Carlos Cassidy.
Here and yes.
Okay, we have a quorum.
Thank you, Shelley. Just briefly, the public health, for particularly the new counselors, certainly welcome you here. This is a kind of a branch off of our health committee. We have lots of things to discuss on the monthly health committee, but on the public health side of it, I'll let our representative for Public Health Department speak here shortly. But in public health, we concentrate more on education and prevention. You know, as opposed to, you might say, our healthcare model, we are focusing, and should so, on, you might say, intervention, where our constituents have something, quote, wrong with them. They go to the doctor, be seen, and get fixed. Whereas in public health, we're going to try on the front end, try to educate and be involved in prevention to reduce the need for, you might say, immediate health care, and on down the line for contract health care. It becomes, in a sense, a bottom line issue. If we're successful on the front end, then we may reduce the need for contract health later on. And for the last several months, we've been looking at exercise and how that kind of is a part of the prevention aspect of it. And I'll let Ms. Pivak, Lisa Pivak, why don't you go ahead and come forward, Lisa, and introduce yourself, and Dr. Gann, and just kind of turn it over to you for now.
Good morning. Good morning. You can hear me fine, correct? Okay. Good morning. Thank you for that introduction. Appreciate that. Again, for those of you that are new that I haven't met before, my name is Lisa Pivak, and I'm the Senior Director of Public Health for the Health Division, and I've been with the Cherokee Nation for 28 years, and I originate from the Peavine community and have been here the duration of my career, and have been very fortunate to have been able to serve this time. And I'll let Dr. Gann introduce himself.
Yeah, I'm David Gann. I'm an OBGYN physician and also the medical director of our public health department. I've been at Cherokee Nation since 2002, and I spend some time doing clinical work still, and I work mostly doing epidemiology and statistics and just medical advice for our public health department.
Most of you, if you did not receive the June and July public health report, I submitted that for your review before this. And if it's okay with you, Dr. Dobbins, I would like to just review a couple of things and update you on this report. There have been some changes and some updates since this report's been submitted. The first of all, in the structure of the report, because I believe this is the first time you've gotten one this extensive and in this early to review. And what I want to say about that is that the way that I structured the report is that each of the things build and intertwine together and build on one another. So I start at the beginning of the report talking about accreditation, and all of the work after accreditation below is part of the prep work we do to ensure our reaccreditation, which happens in August of 2021. As you remember, we were the first tribe to become accredited for public health in 2016. That accreditation lasts 5 years, and then we have to recert. All of our work below is directly connected to our continuing the improvement of delivery of the 10 essential services of public health. We are still relatively young. Public health departments across the country and tribes are, when compared to local and state systems who have been working for over 50 plus years on the delivery of these services. We're basically in the beginning stages nationally, but we believe tribes, when allowed to develop our programs with the lens of self-determination, that provides us an improved, targeted, community-driven approach to improving the health of Cherokee communities. So everything below that you see, where it talks about all of these prep documents that we're working on before the August of 2021, that all supports the work of everything that follows in the report that you see. So if anything that you see in there in the report is categorized in sections that correspond to those 10 essential services of public health, which I said earlier are all interconnected. For instance, the work we do in monitoring surveillance informs the strategies and interventions we select for community work. So having said that preface for the report, I had a couple of things that I wanted to highlight in it, and then I'll be happy to entertain, or if you want to stop me and ask any questions as I'm going through this. Under monitoring and surveillance, what I would like to highlight on this is that the Lynn Institute we completed the tribal health assessment for Adair County. As you remember, we were working with the Lynn Institute prior to the article in September of 2018 in the Washington Post about the U.S. Small Area Life Expectancy Estimates Project, which deemed that Adair County had the lowest life expectancy of any county in the United States. We were already working with the Lynn Institute at that time, and when that report came out and we started to dig into it, as I've said several times in previous meetings, we started discussing how we might dig a little farther into that, because what we were looking at didn't match what we were reading, and it was very hard to believe that these were accurate statistics. So we worked with the Lynn Institute, who is a nonprofit organization that does projects like this across Oklahoma. They did a great project in Oklahoma City and are still working with a couple of zip codes there on a 10-year health improvement project. And the objectives of that assessment were to review basic demographics of Adair County and how they differ from other counties within the Cherokee Nation, to review basic lifestyle measurements of Adair County and how they compare to the other 13 counties in Cherokee Nation, the state of Oklahoma, and the jurisdictions that make up Choctaw, Creek, and Chickasaw Nations. Survey, record, and summarize the opinions and concerns of individuals and groups of influence regarding access to health and healthy living conditions in Adair County. Analyze data in such a way to project potential solutions to improve the lifestyle quality, and also they dug into determining the intent of the CDC study and what, if any, next steps are planned. So having said that, on Tuesday, the Lynn Institute presented to our public health leadership team a 130-page document, which is in the final draft stage. It's the final draft of the document. It includes an executive summary, research methodology, the introduction of Adair County, demographics, quantitative data, 44 specific data facts for the 14 counties were included in that and compared, qualitative outcomes. There were 41 semi-structured interviews with key informant interviews with key informants in Adair County, and there were over 480 online surveys completed by Adair County residents, which, if any of you deal with statistics, that's a huge number to get back. They did 37 data facts comparing the 39 counties that comprise Cherokee, Chickasaw, Choctaw, and Creek Nations. They did public opinion regarding the media reports on Adair County and Stillwell, report outcome analysis and clarification, and then they made specific Adair County recommendations to improve the health and well-being of all residents. We reviewed all of this in a 3-hour session with the Lynn Institute. Currently, the document is with the Cherokee Nation IRB. Per protocol, it has to be reviewed. It has to be vetted through there to make sure that the research and the methodology that they said they were going to do, that they did do, and that everything is sound within the document. We are also reviewing it for the purpose of asking about additional data that we might want to ask for in the future that might have not gotten into the document and for us to absorb and take a look at everything that's in there. And I will tell you on a personal note that this is an amazing document, and I am very pleased to look through it. I think that it's going to be of tremendous assistance in working in Adair County. My hope is that we look within our public health resources that we have and our grants, and I think that we should proceed with looking at other counties as we move forward for the same purposes, because it's a really great document. And we've worked with many institutions before. I've worked with consultants in my 28 years. I've worked with universities, and the quality of work that we receive back for the cost that we paid is just, you can't compare it. They truly are an institution that is serving the public. And I'll let Dr. Gann make a couple of comments from a research perspective.
Sure. So Dr. Comerford and I and Dr. Garrett, Brady, just stand up real quick. This is Dr. Brady Garrett, a new addition to our data staff. He's a PhD psychologist who came over from behavioral health. And so we're reviewing that from a scientific point of view. Did they do it correctly? We're working directly with the Lynn Institute epidemiologist on that. And it's extremely comprehensive, extremely useful. Often these reports will bring up additional questions. If 30% of the public thinks that the main cause of poor health is alcohol, why do they think that? And so a lot of issues like that we're talking about. So the interpretation after the analysis is where all of us get together to look at the report, see what does this really mean? Why are these answers the way they are? Really pleased and very professional and well done and appropriate. All the language that they use, and they do a little bit of interpreting of the data. Like, here's are the numbers, this is why we think it's this way, but not much, because they're not experts at Adair County. They've been there and they talk to the people. I participated in one of the key informant interviews, and it was perfectly done, again, from a scientific point of view. They asked the questions in the right way and transcribed all the answers appropriately and analyzed those. Qualitative data analysis is a little bit more difficult than quantitative data. If I measure all of your blood pressure, it's easy to analyze, right? They're just numbers. But when you're taking people's opinions and ideas and trying to analyze those, it's very different. So it's good.
I look forward to being able to present you with this document when it's cleared through the IRB and all of the appropriate places, and I think that you will glean a lot of information from that. They were very purposeful in a lot of the work that they did. It's very interesting because they even divide up the responses from the key informant interviews, such as people like myself and Dr. Gann, and compare them with the responses from the general public that participated, which I think is very valuable internally too for us to learn from. I think that you'll be very pleased when you see it. One of the things that they did also that was additional that I found to be extremely helpful is that a lot of the online surveys had comments attached to them, and they kept all of those comments. And as they went through those comments, when there were areas of concern that didn't show in the quantitative data, when people cited things that did not come up on the quantitative side as a problem, they dug into that. And they've hired and looked at some reports from the Oklahoma DEQ. They went to the Environmental Protection Agency, looked at several reports, and then got an outside expert to review all those reports as well, to see that if they weren't missing anything, to make sure they weren't missing anything. And so that kind of touch is very important when you're doing this kind of work. So, yes?
Lisa, may I suggest instead of using the initials of the organizations that you say what they are, because a lot of people may not be familiar
Oh,
with
yes,
what they are.
the Oklahoma Department of Environmental Quality and the Environmental Protection Agency. Which Environmental Protection Agency, as you know, is a federal agency, and they had some comments that led them to make sure that they used a federal agency to review the reports, and then also an external expert to review those reports. So, any additional questions about this right now?
Janice?
I have a couple of questions. One is, let me get back to this. The Healthy Native classes are just, what exactly is that?
The Healthy Native classes are what are the diabetes prevention program, and that was a national program that was launched probably 15 years ago. It falls within the Special Diabetes Program for Indians. It's not operated out of public health, but we are partners with them. It's operated out of the clinical side, and those classes in the past were mandated to have you had to be have certain clinical indicators to be able to participate in DPP. What we're doing is trying to work with the DPP program so that they still maintain the integrity of their grant program and what they have to do, but be able to offer that program to people who don't meet those clinical indicators right now.
Okay, so give me just a basic, what a class might entail. I mean, in my mind, you're gonna expose them to, red light foods, green light, things that are better for you, things that are our cooking methods.
You're right on with that. It's a 16-week course, and each of those courses has lessons such as that, something related to that. There might be, some on physical activity. They also have coaches the individual coaches as well that they work with, that the individuals work with out of the class setting. Once they've graduated from a class, and they're in what they call the maintenance phase, and they the coaches follow up with them. And the Special Diabetes Program for Indians and the DPP program do a lot of the follow-up and monitoring as far as making sure that that's happening.
Okay, and so are we allowing spouses or family members that may not be Native, but say you've got a man that is Cherokee, but his wife is white. He's got the diabetes indicators. She's white. Can she come to the classes with him so that they can kind of go through it together?
Now, that's exactly what we're working on right now, is to make sure that we can do that in a way that doesn't harm or cause any grief to the DPP program, because they have very specific guidelines they have to follow. Right now, my understanding is that that person is able to come along, but they don't receive any of the incentives and anything that we're funded to do, but they can sit in with the classes. And that is a huge
It is.
importance, is to make sure that the family, and really family, friends, whomever that you live around, that be involved in this
The support
community.
system.
Yes,
okay,
absolutely.
And then my second question had to do with, I'm curious about this meeting with State Representative Danny Sterling trying to require 4th and 5th graders to do a physical fitness assessment.
Yes, Dr. Gann actually attended that meeting. I believe I was at the National Indian Health Board meeting when this happened, I believe that's where I was, and it happened, and I'll let him address that. It is, what my understanding of it is, proposed legislation, and he got us together because he wanted to get our take on it. We have some concerns, and we have some recommendations for the next meeting about how that might be changed, or what might make it more of an impact. I'll let Dr. Gann address that.
Sure. Representative Sterling and his colleagues are trying to introduce this legislation. I believe they introduced a form of it last year, and it didn't get much traction. They understand it's a very small step in trying to eliminate childhood obesity in our population. Our indicators are very poor for that. So they want this to kind of open the door to future programs to introduce more legislation on mandates on nutrition and physical activity in schools. They just want to do 4th and 5th grade because, again, it's a start, and it would be an unfunded mandate, which is always difficult. And they're looking at a program called FitnessGram, which would be a centralized database, and the schools would participate. And the many tribes across Oklahoma, including Cherokee Nation, are in the schools doing this work already, and that's why he wanted us there. And seemed very open to our opinions and our recommendations. But he really does seem to understand that this one program isn't a fix, but it's a start. Without the data, you can't really manage anything. So we'd use FitnessGram here for a year in Cherokee Nation with some of our schools, and it didn't go so well. But
my concern is that this is some type of a benchmark test they're going to give these kids at a certain point during the year, when over the last several years they've been pulling physical activity out of the schools in favor of more class time.
right.
When I was in school, we had the president's physical fitness test, and I don't know if Keith probably remembers it, those that are close in age to me. But it was, it was, if you were a boy, you had to do so many pull-ups, you had to run so far in a certain length of time, push-ups, stuff like that. It was just benchmarks, and everybody tried real hard to get it. But I'm afraid we're setting these kids up for some real disappointment when we've been doing away with physical fitness in the schools, and yet you need to pass this test at the end of the year. So that's my concern.
And I think having used Fitness Gram before, it's more of an assessment than a test.
Okay.
And so it's, number one, it's validated. So they know that it works for 4th and 5th graders. It doesn't work for children younger than that.
Okay.
And that what it reports, what it prints out is a report for the parents. This is what we found in your kid. Here are some recommendations.
Okay.
So it's, there's no awards or there's no winning or
It's not a
passing.
comparison with other students. This is your information.
Yes, ma'am.
Okay. All right. That's all I have.
I want to speak to that just a little bit because I plan to try to make the next meeting, and because it did not happen on the 15th, it was actually canceled. That 8:15 meeting did not happen, and it's been rescheduled, and I'm able to attend the next one with Dr. Gann. And I want to. My understanding is that Representative Sterling is very open to changing and other ideas, and I think this was just his start of getting childhood obesity on the radar, and he didn't know exactly what would be well received and not well received yet, and what our opinions are. And so from our perspective, I think our plan is to develop some alternative ideas and propose those, and what we think might be of a better assistance in that area. Because I agree with you in the sense of we've been removing funding. My son has physical activity 1 day a week.
Yeah.
And then we give them an assessment and where they fall, and that might not be the most effective way to do the work. And so we will be working on that and making sure that what we support obviously is something that we feel like is best for our communities.
The public health educators in Mays and Rogers County have worked particularly in the elementary schools, and they have these contests going where the kids try and walk 100 miles at school. They've done some really good things, so I hope their data is getting back to you, and maybe it's something that
Yes,
can be
yes,
implemented, because
it is.
I'm pretty excited about that. Okay,
Thank
really,
you.
that's all.
You like- John?
Yeah. Lisa, thank you for all the work you guys do. The study now, that's going to give us more ammunition, so to speak, when we start asking for funds, looking for grants for what we were talking about, something similar to Marcoma, or at least some money for the different districts. And is it still December that we're kind of waiting on?
Yes, yes, for the physical activity by district assessment to supplement that, yes, and I'll speak to that here in just a few minutes at where we are in the progress on that too. But what this report is going to do, it's going to show you what the the small populations did not show you. It's going to show you the current state of health in Adair County, and it's going to show you the opinions of the people who participated in the qualitative piece of it. And it's going to show what exactly is going on as far as the health status of the county. So,
You're going to talk about the work group thing here?
yes, I am going to talk about that in here in just a few
Thank you.
minutes. Yeah.
Mary?
Lisa, I have to tell you, I cannot wait for the IRB to finish with that, because I am dying to hear your presentation on that. I really am. And I'm thrilled that you all work with the Lynn Institute, because my goodness, the caliber of that organization is legendary, for lack of a better way to put it. I do have a question on the report that you all presented here. Do we have any programs relating to drinking alcohol?
Alcohol and other drug-related programs are located within the behavioral health programming, and so I don't report on those in my report.
You don't report on those in your
No.
report? I was just curious. I was also curious as if I hope the Lynn Institute did something on how many of those deaths were attributed to drinking.
There's, the surveys address that. So it was people's opinions. There's some information about alcohol in there. It's a question about, have you had a close family member die early, and what did they die from? So all those data are in there, so.
Excellent. Well, I'll be really excited to hear your all's next presentation. Thank you.
Any,
Yes, Lisa, the membership here at Marcoma usually runs around 9,000 to 10,000, and that's a good number. Have we been able to gather any data there from people that have joined and you know, where they were when they came in, maybe weight-wise, or I don't know what kind of, how much information we can gather from them, but have we done like a before and after or monitored any of this for the last 10 years?
most of what we have is anecdotal, and when we opened the facility, we talked about this very thing of what was appropriate for us to collect for someone to come participate in physical activity. And there was an extensive discussion about that, and the conclusion was that there really wasn't much that we could ethically collect to get someone involved in physical activity and then monitor them throughout the process. So we have not done that. We do have a lot of, as you will see, anecdotal, and I guess I could say the increase in the membership and the continuation of a membership after 10 years speaks to some of the success of the facility.
We have people there. I mean, I know we don't do enough success stories. We're always going the opposite. We're going the Native Americans' highest alcohol rate, Native Americans 3-to-1 diabetes. You know, these success stories that I see daily at Marcoma. A lady was talking yesterday, lost 90 pounds and got off of insulin. And you know, we have an 88-year-old lady there every morning, 2 miles on that treadmill. Most of you know who she is. She's most everybody's seamstress here in Cherokee County. You know, when you hear stories like that, we don't put that on in the paper anywhere, but you'll put somebody that's diabetic and having a difficult time. We need those success stories out of there if we could. I know that's not your responsibility, but those are some really good stories there that some of those participants have gone through.
There are some very powerful stories, and I get emails pretty consistently from a parent or a constituent that says, hey, this particular trainer has been working with my child or working with me, and what a difference it's made. And that's a phenomenal staff at the Male Recreation Center, and I can't say enough good things about them, and you're exactly right. There's a great amount of success stories there that I see personally every day when I'm there, so I agree.
Is it possible for the outlying clinics like Salina, Redbird, Bonita, you know, Oshaleta, when a person is going through rehab, sometimes I see them in Marcoma,
Yes.
and there's a lady there that does physical therapy.
Yes.
So there's many people that utilize that facility. Is that something we're looking at in other areas?
I would say most definitely. I think that's part of the work that we're doing with this physical activity assessment too, that I'm going to speak about here, is to look at what are solutions for particular communities and what interest is there, and then more than that, what kind of community-driven support is there to maintain facilities and places that we put together, or programs with there. What are people interested in?
Yes.
I know that in the Lynn Institute study, some of the questions that were asked of the general public were great, because it was, you know, what do you do for fun now, and what would you want to do? What do you want to do for activity? And we got some really specific answers about that were pretty consistent across the board about what people want to do with their families for physical activity, and not more than physical activity, enjoyment and fun and fellowship.
Yeah.
So
One more question.
Sure.
The facility there, we're operating on what percentage are we operating from grants? Then how much does the tribe contribute to that?
for the Male Seminary Recreation Center, we have the majority, I would say probably 95% of that is funded by the tribe. The only thing that is not funded by tribal dollars are 3 staff, I believe, who are graciously funded out of the Special Diabetes Program for Indians and work on the DPP program and on lifestyle interventions. So,
Okay, thank you.
so-
Well, particularly for those of you that are new, I guess this kind of got jump-started when we were looking at ways that we could provide our citizens an opportunity like Marcoma is in our outlying areas. And as part of that discussion, we, at least I have, I think most of you have been contacting private facilities in your area, just seeing if they would be interested in some kind of Cherokee partnership where the Cherokees might subsidize. We're in the early stages. but it's taken a while, isn't it, Sean? Yeah, and I'd like to get going, I'm ready to get going, but because I have citizens all the time ask me about it. So, do you have any particular message for all us individual counselors? Should we continue this conversation with private gyms at this point? Because once we get this report, are we gonna be in a position where we can move on it, or are we gonna have to present a budget to whoever writes out the checks? How does that, can you give us a feel on kind of timeline on that?
I can't give you a feel on right now on what the constituents are going to say on the physical activity survey because we're still in the stages, which I'm going to talk about on the timeline that you have on your report of where we are. We're on time, we're on schedule, and I won't know until that. We are anticipated to have that to you in December so that you can, what we are doing, do you want me to go ahead and speak to where we are on that right now? Okay. First thing I'd like to say, if you have your report that we are on schedule. Dr. Brady Garrett, who Dr. Gann just introduced a few minutes ago, works with us. He's a Cherokee citizen and works as an epidemiologist in our program. We're very fortunate to have him, is the lead person on our end for this particular survey. He is working with Dr. Paul Spicer from the Center for Applied Social Research, Department of Anthropology at the University of Oklahoma, and he's also working with Dr. Bryce Lowry, Assistant Professor of Regional and City Planning in the University of Oklahoma Gibbs College of Architecture. So I'm happy to tell you that we have completed the survey design, and it has received Cherokee Nation IRB approval. We've received the approval letter. The design has changed a little bit from focus groups to more survey methods by district, and we are still working on exactly how many numbers from each district that we're going to have, but we have a pretty good idea right now, and we've put together a survey that complements. It doesn't repeat what the Lynn Institute has done, but it digs deeper into what the Lynn Institute started asking. So we're going to be doing that on the ground with our staff at already scheduled community activities. We're putting that schedule together right now as to where we're going to be. So instead of going around and just, setting up somewhere to have people come to us for a survey, we're going to go where people are already going. We know some of that information from the preliminary results of the Lynn Institute findings of where people are going. And then intuitively, most of us know where we're going in the evenings. We're going to kids' ball games. We're going to different school functions, church functions, whatever. And so we'll be setting up, getting that taken care of during the months of September and October. We'll have November for analysis. At the same time, the College of Architecture is actually mapping the actual built environment for us in the 14 counties so that we can compare real and perceived barriers to physical activity. So they'll be able to show us what's actually physically there, and then we'll be able to lay that over with what we're learning so that we can say, in this particular district, this is what we see. In this particular district, this is what we're seeing and this is what we're hearing, so that we can work on those barriers to physical activity. As far as any type of recommendations of what you should do right now, I can't provide that until I know what the information says. Dr. Gann, do you have anything to add to that?
I think the survey is going to come out really well with the experts from OU helping us. We're looking at anywhere from 50 to 200 surveys per district statistically to get a good sample. We've had quite a debate on exactly how many we needed, but the questions are very appropriate and will be illuminating. When you overlay the built environment, so you look at the number of parks, number of sidewalks, swimming pools, bowling alleys, whatever you want to put in there, with people's perceptions, it'll really help each of you individually in your districts to say this is what the people there want to improve their health for physical activity specifically. That's really the hard part, right, is figure out what really, imagine building a recreation center that no one comes to because no one wanted it. That would be the worst. So trying to really feel out what the community wants and how do we get it done for them.
I will say that something I didn't mention that goes along with this is that the Lynn Institute's report for Adair County, I was absolutely blown away by their asset mapping of the county as far as the assets for the entire county, went on pages and pages of everything that's available in Adair County and also what's not available. And within the comments that are on the preliminary report, I'm very hopeful. I'll put it that way. There were some very good comments about people that are appreciative of the work that's going on, but also know that there's need for improvement. But there seems to be a willingness to get together and get it done. And I think that was very hopeful. And this isn't going to be a document that sits on a shelf. It's a living document that has to continue to be updated, and the recommendations for it have to be carefully implemented and followed up on.
Just kind of an FYI, whenever this first came about, and there was discussion about gyms and participation, I did reach out to our clinic in Jay, and I talked to people there, and they're very receptive to that. I also reached out to a gym in Jay and a gym in Grove, and to see if they would be interested in, partnering with the Cherokee Nation and having Cherokee citizens come in. And I've been I've been contacted twice by both of those gyms, wondering where we were at, and they're ready to go. So they were all excited. But so there is some excitement about it. So, and I know that my district's not is not the only one that way, but the gyms are excited about it. I can tell you that.
And I think part of it's going to be looking at what people say they want to do, and then figuring out how to do that. For instance, if the community overwhelmingly says walking is the number one activity that they want to do with their family, then we have to look at what's the best, how do we build the environment for walking? And that's just for example. We don't want to build a CrossFit center for a population that wants to go walking every day, because that's not smart for us to do. So hopefully this will give us by district some really good ideas of what it is that we need to do. So with the surveys, we're not limiting them to a number. As many people that want to participate in that, we will do that, and we will make methods for them to do that, make sure that it's easily done they can easily take the survey, and we will make you aware of where we're going in your district so that you'll be familiar with that too before we do it.
So Lisa, once the studies are presented to us, we'll have a chance to visit with our constituents about the direction. Is that right?
My hope is that we're able to use more after we do these surveys, and we look and yes, that we by district can do what I would call in conjunction with everyone, a community forum, and talk about this, talk about what the results say and what people and have an understanding of what that means for the community.
And Canaan, different Adair County folks, let's say walking was one of the things that they mentioned. Well, we know it. We live there.
Mm-hmm.
We're going to tell them there's already plenty of places to walk. Let's focus somewhere else. You know what I
right.
mean? And just, I would, like you were saying, the community events, I think that would be great.
That's why we switched under the advice of Dr. Garrett, Dr. Spicer, and looking at, from the College of Architecture, Dr. Lowry, to more of a survey than a focus group, because what we feel like is that in the end, that we can take the results from the survey, the results from the work from Lynn Institute, and then have more of a community forum saying, here's the information, let's talk about it.
That would be great. One speaker was mentioning a while ago about the data. I know that'd be kind of intrusive for some people, or you said it's hard to find a way that's ethical to track folks, and hopefully it gets in our districts, but some of the folks I know, some incentives, if you sign up, you get something and let us monitor you, and then we'd have they would,
I think
they kind of be volunteering
Yeah,
for
if
it.
we volunteer that information, could you have the data? If people agree to a consent letter, said, I don't mind you checking my blood pressure before and all the vitals and so forth, would that be allowable?
I'm sure that it would. It would still, something of that nature would be under the purview of the IRB for certain, wouldn't it, Dr. Gann? And
Yeah,
they would
so-
have to make sure that we weren't coercing people. I think the concern would come in like this. So we offer you an we offer and ask you to do this. People have to understand that their membership, free membership as a citizen, is not linked to their progress or their ability to
Sure.
participate in this or their willingness. We don't want that to be, we don't want them to feel like that is, that they have to do
What
that,
sooner
so.
they're giving an iPad, then they lined up.
Yeah.
And it's
Good point, though, Sean.
At a certain point, it becomes healthcare data, which falls under a whole new set of laws on how the information can be handled. And it takes a lot of trust, too, to know that we wouldn't print up that Joe Bird this week gained 5 pounds because he didn't go to the gym. It's very personal information that we're collecting. And so, yeah, there'd be a lot involved with that.
Yeah,
Thank y'all.
good information.
Victoria?
Yes, I have a comment and maybe a question. I've already had a call from my Bonita Health Center about a patient that needs a workout program and wants to come to Bonita's Fitness Center, but she lives sort of in a rural area in Counselor Austin's district. And I'm just wondering if, and it's too far for her to come regularly, and I don't know what's available in the Chelsea area, but I'm wondering if we could also look at some type of an agreement with maybe Pelivan or in our areas where it's possible for us to offer rides to some senior citizen that really needs this, can't get there. Is that something we could look at in addition to what we're already looking at?
Sure.
Sure. Well, part of the process is when there are facilities, like you mentioned, there's places to walk, but people aren't going, is figuring out what are those barriers. Is it childcare? Is it time? The hours of operation and transportation. So that's, the community forums will really bring that out as well.
Okay. Thanks. Thank you, Chair.
Joe?
I have seen a program that they have in Tulsa at the gyms where we're talking about these monitors, just little things that just, when you sign up for your membership, they go to your phone, but then the facility has them where if you go to an activity, you get 2 points, or if you walk a mile or you keep your heart rate up for 30 minutes, you get 3 points. And when you get to 100, though it might be a shirt, or the incentive you get to 500, it's earbuds.
That's good.
And
That's good.
but they're allowed, when they sign that, it goes to their phone so they can keep track. And then it's almost like the Fitbit, but they do it at the fitness center. And if you want, they'll put it on a screen while you're working out, so you don't have to have your phone to see what you're doing. It'll have your ID number, not your name and your picture. 'Cause some of us wouldn't want to do that. But those incentives and those programs are out there, that they do supply those with the memberships, and some of these memberships are like $10 a month. And I think that's what some of them use the data for, because it helps them create what kind of fitness inside they need. Like, are people using treadmills, or are they using the free weight? So those programs are available, they do, that we could monitor in the different areas, which would help basically do the data that you're looking for. So, and it's sort of a self-motivation for some of these guys. I mean, if they see something, it's a visible thing. I haven't did anything. I haven't taken 20 steps in an hour, but it's there. So those programs are available.
There's absolutely a lot of ways for utilizing technology to improve physical activity, and also the incentive that's reminiscent of our old Wings program that started, and it's still here, but it started in '96, and we used to have incentives and we mainly for kids at school. When you get to 50 miles, you get this. When you get to 100 miles, you get this, and they do work well in some circumstances, especially once people stick with it, and then the incentive becomes, I feel better, not that I got anything. Yeah. So. Any additional questions about the physical activity piece or survey?
Would we also, in these outlying areas that we talked about, they may not be aware there, we do allow non-tribal members into these facilities for a minimum cost.
Yes.
Which, if you do it right, that might pay for a trainer, maybe 2 or 3 trainers. Just a thought.
Yeah, absolutely. We need to get that message out. Any other questions? If not, I have one more highlight, if it's okay, on the report. I know we're running close to time. In the report, and I'm happy to take feedback on the structure of the report as you look through it, and any feedback that you may have about how it might be more effective for you and give you the information that you seek. One of the things that I wanted to bring up is that every other month when I send you a report, I'll be doing a public health research highlight. and it will be on something that is a Cherokee-approved research that's going on in the health division, especially in the area of public health. And for the June, July, if you look at your report, I highlighted the P20 project that is headed by Dr. Ashley Comerford, who is in the audience today and part of our team. Dr. Kahn at the IRB recommended that we highlight this. If you look through there, it talks about the work that she's done and the amount of publications and expertise that she's gained through working through our research department. The research department is headed up by Dr. Sohail Khan, and he is relentless in his pursuit of very targeted and important research that is fair and safe for Cherokee citizens. I have worked with Dr. Khan for over 20 years, and I can tell you there is no better defender of our citizens when it comes to research and in being invasive and harmful. He will never allow it in the sense of research or publications. And I want to highlight some of the work that's going on in that program every couple of months for you as well. So if you have any questions about that, I'd be happy to field them. And I'd like to ask Dr. Comerford to stand. Dr. Comerford is a Cherokee citizen from Foyle, Oklahoma.
Wow.
So, are there any other questions that I can answer for you today?
Thank you, Lisa. Thank you, Dr. Gann.
Thank you.
No old business, no new business. Any announcements? Our next this subcommittee meets every other month. So the next meeting is Halloween.
Okay.
It's Halloween. Dress up. Whoever gets the best uniform. Co-chair the meeting. Yeah. Entertain a motion to adjourn.
So moved.
Okay, second. All those in favor?
Aye.
Opposed? Meeting adjourned.